Hey, Dr. Vicky here. So let's talk today about a patient that came in his late 50s last week, traveling through town as a truck driver, and he was having lower back pain and upper back pain, but what was complicating the issue was he had muscular dystrophy. And he had this type of muscular dystrophy that isn't progressive like some forms, but it still affects a lot of things in his body. His muscles were atrophied and starting to deteriorate. And what was interesting was that his muscles in his upper body weren't deteriorating as much as his lower. So we had that to kind of look at. Then also he had a really severe issue where it started was in his throat, and that caused him to choke because his soft palate wasn't firing properly via his brainstem. So he had a couple of brainstem cranial nerve issues as well. So we were discussing a lot of different things. And so he was only here temporarily because he was driving through Denver. But what he's going to do is he travels through Denver once a month. So he's going to come back in and have a neurological consultation next time, because I was mainly dealing with the lower back because that was the main issue that he had when he came in. But you can't overlook some of the other things that are going on in their history. So if you can ignore it, but it's still playing a role in what's happening currently. So we had to discuss some different things. So what happened was his throat and his hands were the ones that first started to deteriorate. So the muscles in his palm particularly. So these things are clues as to where some of this issues are coming from. So when you look at that, you look at the age of onset too, because this started when he was in his 20s. So it didn't start in his 50s. It started in his 20s and he's in his 50s now. So things have kind of progressed, but then they stopped. They didn't really progress from there. So fortunately for him, because there's some types of muscular dystrophy that aren't so accommodating. So he walked out feeling a lot better. We did get him able to get in the truck without a whole lot of pain, and we're going to see how his condition progresses from there next time he comes in about a month. So if you have any issues that may look like it's not a chiropractic case, maybe send them my way. I'm at 303-385-3432, or you can reach me at souterchiropractic.com.